Good morning, everyone. I see folks trickling in. Want to thank you all for being here today. My name is Jackie Rosa. I am the Chief Programs Officer at United Way of Metro Chicago, and I'm super excited for this conversation today. Thank you for joining us again at United Way of Metro Chicago, State of the Social Safety Net Conversation. I also want to thank our panelists for making the time today. We know that they are extremely busy, but they are excited also to be able to share their information and leadership experience, especially in this moment. Again, our goal of this conversation is to share local data, lived expertise, and the voices of our trusted leaders to help us better understand how policy decisions, shifts in funding, and the economic decisions are shaping the lives of our neighbors and specifically our region. So today's conversation focuses on the impacts of the local safety net since the passing of H.R. 1, also known as the One Big Beautiful Bill. H.R. 1 was signed into law exactly 1 year ago today on July 4th of 2025. The law enacted new safety net policy changes that have impacted thousands of residents across Illinois and the Chicago region. Policy changes to critical benefits like SNAP, Medicaid, and other essential services means that our neighbors and partners have to navigate a very complex system that was already complex and are dealing with a new challenge of understanding the new requirements and whether or not they qualify. Many people who previously qualified to receive benefits like SNAP and Medicaid are no longer eligible to receive essential support. And as you all know, many families are already living paycheck to paycheck. The cost of living is only getting higher. And so it's really difficult to be able to meet basic needs in this moment. And when we say basic needs, we mean food and healthcare. At United Way, we're always committed to ensuring that families can access their immediate basic needs. And we have extremely great partnerships. One of the partnerships we want to highlight right now is our investment in the work of 211 Metro Chicago. It is a 24/7, 365-day-a-year hotline that is helping families and individuals get connected to housing, food, healthcare, utility assistance, and other essential supports. Through our partnership at 211 with the city, the county, and the state, we're able to connect families in real time through the 211 line. All you have to do is call 211, and the only information required is your zip code because we want to make sure that you are being connected to services locally. So before we get started, I want to just highlight some numbers that we're seeing and some data points that we're seeing through our 211 helpline. Again, this helpline is a free helpline that connects families, but it also gives us some really important data to help us better understand what's happening on the ground. So I want to just give some numbers that are very stark to help sort of set the stage of what we're seeing happening in real time with the implications of the H.R. 1 bill. So in the first 6 months of 2026 compared to the first 6 months of 2025, the 211 helpline has seen a dramatic increase of support being requested in key areas. So our requests for healthcare have increased by 100%. Our requests for food and meals have increased by 68%. Requests for clothing and personal needs has increased by 34%, and requests for housing have increased for 31%. This data paints a clear picture of the need, and the difficult truth is that these in calls and requests will only increase as time goes by and as we see the further sort of effects of H.R. 1 and the effects of what's happening at the federal level locally. So for today's conversation, we want to acknowledge the challenges, but really our goal is to help all of us better understand exactly what has happened since the signing of H.R. 1, what's on the horizon, how we as Chicagoans, as people that live in the region, how we can really understand how this is affecting our community, how philanthropic leaders and other corporate leaders can step up and help during this difficult time. So this is really what we're trying to accomplish today, and we're so grateful that everybody has made the time. But before we begin, I want to do a quick housekeeping note. Please submit your questions through the Q&A button at the top of our page. We will be monitoring the questions, and we'll work really hard to try to answer them as we reserve time at the end of the conversation. So with that, let's get started. I'm going to introduce our participants today, starting with Dr. Ezike, is the president and CEO of Sinai Chicago, Illinois' largest private safety net health system. There, she has focused on advancing health equity through innovation, collaboration, and investment, providing quality care and service for the people they serve. Previously, she was the director of the Illinois Department of Public Health, where she navigated the state through COVID-19 pandemic. Dr. Ezike is a board-certified internist, pediatrician, and nationally recognized public health leader. She holds degrees from Harvard, University of California, San Diego School of Medicine, and has a business management certificate from the Harvard Business School. Our next guest is Graciela Guzmán. She serves as the senator for Illinois' 20th district, representing communities across the Northwest Chicago. She began her public service in 2025, serving as the vice chair of Senate Education Appropriations Committee and sitting on the Health and Human Services Appropriations, Higher Education, Human Rights, Public Health, and Veterans Affairs Committees. Senator Guzmán also serves on the executive team for the Illinois State Progressive Caucus, chair of the Illinois State Latino Caucus, and the co-chair of the Affordability and Tax Justice Coalition. Most recently, Senator Guzmán was the chief co-sponsor of the state's Fresh Bill, which will provide one-time payments to Illinois residents who have lost SNAP benefits due to new federal requirements. And lastly, we have Kate Maehr. She is the executive director and CEO of the Chicago Greater Food Depository. She has served in the role since 2006 and has evolved operations of the food depository, expanding the distribution to meet the rising demand for food across Cook County. Kate is a leading voice in the mission to end hunger and passionate advocate for anti-hunger policies, for which she has been called to testify before Congress in the Illinois General Assembly. We are so thrilled to have these experts and leaders today on today's panel, and thank you all for being with us. Now let's get into this discussion. All right, so my first question is actually for Senator Guzmán. Senator Guzmán, H.R. 1 is often referred to as the big, beautiful bill. It's prominent in the news headlines and public conversations over the past year. While much of the attention has been on SNAP, and thank you again for your leadership as the chief co-sponsor of the Fresh Bill, the impacts extend across multiple programs that support Illinois residents. At a high level, we really want to understand what this means on the ground, and we really want to help people that live in Chicago and in the state understand how the legislation is impacting their communities and state legislative affairs. Can you walk us through this and help us really just dig a little bit deeper for folks that might not be as familiar?
Yes, hi, good morning, everyone. Buenos días. State Senator Graciela Guzmán. I proudly represent the 20th District in the northwest side of Chicago. And really thinking about, I think the moment that we're in, I want to offer just a quick example of things that we're seeing in my district that I know is being shared by many of my colleagues across the state in this moment. So we were closed out session really, really early, 4 in the morning, in fact, 5 in the morning on June 1st. I think slept a wink, came home June 2nd. And as we were driving into the district and getting into things, one of the most visible things that we've been tracking is how many corners does the line wrap around in our local food pantry? And that tells us just so much of, the pulse of a community. And so to be getting ready to drop off my goddaughter at school, at so many things, and see pantry lines already wrapped around all 4 corners and down the street before 8 a.m. in some instances as a really, really stark indicator of just the gross food insecurity that folks are facing in this moment. It has been a longstanding piece of that many of us have been engaging in our communities, but it's at an all-time high. And we have constituents who have been calling our office nonstop as they have been embarking questions from paperwork to am I still eligible, to I'm really scared about how I'm going to be able to put food on the table for me and my children and my family. They're scared about what that uncertainty and what that means for them at a moment where they're struggling with rent. They're struggling with the living of just every single cost possible, but food just boils it over. And so really thinking about, the promise of the fresh legislation while also looking at it in a real talk way. Fresh allows us, I think, a way to be able to meet this moment of emergency, to understand that the need for food is fundamental to our experience. And that means that at a time of uncertainty, one of the tools that our state can choose to lean into is to use state dollars to be able to bridge Illinoisans in an emergency way, should they lose their SNAP access for any which way. So Fresh is a program that will allow folks to be able to have one-time emergency funds at the loss of SNAP. We're really grateful, I think, for the Greater Chicago Food Depository and the work that they have done, I think, to help propel how this will work. But it also helps highlight exactly that it is emergency. It is one time. It is a stopgap. We know that folks will have ongoing need, right? And so it really puts it back on us at a moment that the federal administration and their uncertainty means that states will have to think about how we feed people in perpetuity, how we provide structurally for what is being taken away from us, that we don't allow Illinoisans to go hungry just because we don't have state dollars. And so looking forward to the conversation this morning, but it's one of the things that as we balance both the legislation that is passed alongside its limitations and we think about our state's budget forecast, I believe the budget is a moral document. It means that we need to find good revenue that centers working class people and our ability to be able to secure and protect the safety net. And that's much of the work that we've been embarking on this session and furthermore. Thank you.
Thank you, Graciela. Senator Guzman, I have a follow-up question here. So I want to dig a little bit into the SNAP requirements, right? Those are the things that have impacted changes as to people's eligibility. So if you could talk a little bit about that, and also if you can sort of highlight some of the new SNAP requirements and how they're impacting already vulnerable communities.
Yeah, so I think a couple pieces that I would elevate, knowing that there's folks that are experts on this call. So I think one piece obviously is much more frequent work requirements and paperwork in general. It just means a lot of administrative barriers and burden that folks have to cross. And what we do know is many of you, I don't know if you're like me, I have a pile of mail sitting at my house, and I'm diligent. I'm diligent, y'all, but I still got a pile. And what we do know is life be lifing. And we have a good set of our Illinoisans that are just trying to do the right thing, but the mail is a real thing. Getting paperwork filled out is a thing, especially when maybe you don't know how to answer the question or need help scanning something. And so what we do know is the frequency and the changes and this kind of documentation will inevitably mean that folks don't get to keep the resources that they need, right? That's one big burden. Two, we're also aware that there are looming changes in terms of who is eligible for the SNAP program. So beginning 10/1, qualified immigrants across our country are going to face changes in their eligibility, not just for food, but also for healthcare. That literally means we're changing who gets to be seen as quote unquote worthy according to the federal government to be able to receive these kinds of services, right? So those are some of the changes that we highlight when we think about both administrative changes that will make it harder for folks to be able to maintain access, but also changes to eligibility that will mean that we'll need to think about Illinoisans that right now presently have access to these resources, but may be losing them.
Wonderful. Thank you so much. And then this is actually a perfect segue to our next panelist, Kate from Chicago Greater Food Depository. I want you to, again, to really talk about, as you know, the largest food pantry, I believe, if that's correct, serving folks in Chicago and I believe suburban Cook County. If you can talk a little bit about what you're seeing with food access, with already a system that is broken. And then I think it's really important for folks to understand just the partnership that the Chicago Greater Food Depository and the coalition that they built in terms of saving SNAP and in regards to the fresh bill and working with Senator Guzman to be able to provide that emergency assistance in such a dire time.
Great, thank you. And I'm even, before I even get to that, I just want to start with a little bit of gratitude. I'm so grateful, Jackie, to you and the entire United Way team for the work that you're doing, the 211 infrastructure, but also the important convening of conversations, because I think one of the things I just want to lift up is this is not okay. And we can't just let this happen and not take the moment to come together and understand what is happening all across this city, this state, this country, and then, frankly, put together plans and coalitions to respond to that. And so this space is really important, and I'm so grateful for you. Hearing Senator Guzmán speak, I'm reminded why she is one of the fiercest leaders that we have in our state, and I'm so grateful for her. So I want to do just two quick things. First of all, you asked this question about need, and I'm going to start by saying, even before the bill that is now known as HR 1, or some people refer to it as the One Big Beautiful Bill. I actually don't like to use that, so I will call it by its official name, HR 1. Even before HR 1 was passed a year ago, many, many, many people were struggling mightily. The combination of the disruption that happened because of the pandemic, there were so many people who lost an economic toe or foothold, and we're still really struggling to move out of that, combined with inflation, and in particular, food inflation, but also the rising cost of rent. We were seeing people last spring of 2025, struggling mightily. Then on top of it, there was a bill that made significant changes to the single most important frontline defense against hunger in this country. You asked this question, is the Greater Chicago Food Depository the biggest food bank? We are one of the largest food banks in the country. I'm not proud of that because I think that's a reflection of the need. So we know that there are more than 1 million people just here in Cook County who face hunger, who are making really difficult decisions every day, and they have to turn to a food pantry. So we are privileged to partner with more than 800 emergency food programs. You heard Senator Guzmán talk about one that she saw as she was coming back from session, but there are 799 other programs that are on the front lines of feeding our neighbors, and they are doing a booming business. Now, let me just for a moment talk about what happened in this bill and why we are so worried. There were 3 really significant changes to SNAP. The first, as Senator Guzmán referred to, there's a group of people in this country and in Chicago and the state of Illinois who have been able to receive SNAP benefits in the past that the federal government said no more. And this is a group of individuals who are legally present immigrants. They are people that we've said, we want you to come into this country and we want you to have a thriving life in this country, and we're going to allow you to access medical support and also food. We have always said that, and then all of a sudden we just said no. And so in the city of Chicago, or frankly in the state of Illinois, we're talking about 16,000 people, benefits just shut off, gone. No path, nothing, just gone. That's number one. Number two, there have always been work requirements for SNAP, but what this bill did is it changed who has to be eligible, and it also changed the bureaucracy. Frankly, I think more than anything, what it did is it took some of the most vulnerable people in our state and is now subjecting them to a set of requirements. I personally think that a mother with a disabled child shouldn't have to go and demonstrate to the state government that they are doing everything they can to get by, but that's now what this bill is saying. When we started last July, we knew that there are about 450,000 people in the state of Illinois that would lose their benefits. In partnership with the state, and I just want to call out the Illinois Department of Human Services. They have done an amazing job over the last year. We were able to get that number down to a much lower number of people who would lose because of these newly defined work requirements. And then finally, there's a really big change, and that is still to come. And it is hard to overstate how disastrous this change will be. It is a change in who pays for SNAP. So SNAP has always been a federally funded benefit. The federal government has always paid, since the SNAP program was founded in 1964, 100% of the benefits. What this bill did is said, you know what, states, you're going to have to pay. And it did not give states much time. And it is using a frankly completely confusing metric that has nothing to do with really the program and how it impacts people's lives as the way to determine how much. So what we know in the state of Illinois, we may have to pay $800 million a year in order for the SNAP benefit to stay intact. And then finally, what this law said, which a lot of people who signed off did not quite understand, is that if the state doesn't pay 100% of its bill, the federal government will pay nothing. And our concern, which is a very real concern, is that there are parts of this country where the program will go away in its entirety.
That was very sobering.
Yeah, so
I am
that
like,
was,
I
that
thought
was,
I
that was more
understood,
dramatic
but
than I meant to be. But that gives you a sense.
No,
There are
it's
46 million Americans who benefit from this program. It is, and maybe just the data is so clear
Yeah.
on the benefit of this program.
Yes.
It's not just that you get food. People who receive SNAP benefits, mothers and children, will be healthier. There's a whole host of data to indicate the power of this program, and yet we are choosing to ignore that in this really sobering moment.
No, and I think earlier in the conversation, I named those numbers that we're seeing an increase in calls, and this is even before all the effects are taking place. So I can only imagine what those call volume will look like after this takes effect. So that was, I mean, just shocking, to say the least. And, I consider myself a somewhat expert on the safety net, and just hearing that data is just unbelievable. So thank you for explaining that in such a thorough way, so that everyone here on the call can also have that information and be able to thoroughly understand sort of what was coming. So Kate, if you can, I think the fresh bill, I want to lean into that a little bit, because it is one solution. We need many solutions, and we need many things to take place. But if you can talk us through the little bit of around the fresh bill, and sort of how that's going to help sort of alleviate some of the burden of what families and individuals are facing in this moment.
Yeah, I appreciate that. And I just, I think everyone on this call, and frankly, everyone we know. So here's a request for everyone to spread the word. We should all be really proud of the state of Illinois, and we should be proud of our elected officials who did something really brave and frankly inspiring. And there's more work that we need to do, but I think we can take the victory of the fresh bill as a reminder of the power of advocacy. What the fresh bill does is it gives a cash benefit to people who are losing the program. Really simple. There's a group of people that all of a sudden, because of these new bureaucratic requirements around demonstrating that you have a job, they're going to lose their benefits. So I told you we started the year with 450,000 people through really hard work. We got that down to about 100. It's right now about 140,000 people or so who are losing their SNAP benefits. So that is the population of people who will be eligible for this one-time direct cash assistance benefit. It will come onto their link card. They will get it. They will be able to go out and spend those dollars in a grocery store. We haven't talked as much about this on this call because we're focused on neighbors who are vulnerable, but I will just also note our economy in this state and in this country, which already has some challenges, will really suffer when we take money away from people. That money has been spent in grocery stores to purchase food from the food industry and from this country's farmers. And so there's going to be a huge impact, particularly in communities and in states that have a strong agricultural sector like we do. We're going to feel that all the way down to the Illinois farmer. And so that's just something I'm also worried about. But Fresh will allow us to provide that. Now, it is not going to replace SNAP. It is not nearly as big of a benefit as people would get if they were on the program, but it is a way to ease people down, because at the same time, I just want to go back to what I said at the start, which is all of this is happening, and food pantries across this community are already at record levels. We distributed more food in the last year at the Greater Chicago Food Depository than we have ever distributed in the almost 50-year history of our organization, and that includes during a pandemic. We have more people turning to us than ever before. And so we need to find other ways to support people. What this bill does is it provides a little bit of support to people, which is it is a moral imperative to do that. So I loved hearing that the budget is in fact a moral document. It also reminds us of the power of communities and leaders coming together and insisting that we act with morality to address the needs of our neighbors.
Thank you. No, thank you, Kate. I think that's super important. And I just want to share that, United Way was really proud to be part of that Save Our SNAP coalition and play an active role in helping support the fresh bill. So I think that's something else that United Way really wants to lean into, is thinking about how we're providing dollars to the organizations doing the work, but we're also trying to champion coalition work that we know is super important in terms of that systems change, because we know that nonprofit alone is not going to be able to do it. So I love that you, well, not love, because it's actually, again, very sad. This is a sad conversation. I love, but though I appreciate, I should say it's a better word. I appreciate how you connected it back to the local economy, because I think that that's what people need to understand. It's a domino effect, right? This is not happening in a bubble. This is not, a standalone issue that only a certain group of people are going to be, challenged with. This is going to affect our local economy, and more importantly, the local agriculture, right? That is, that these farmers need this not to happen, because if not, it's going to affect their livelihoods at the end of the day. But so thank you for highlighting that. So I'm going to move on to healthcare, which, again, back to the interconnectedness of all of these issues. Healthcare and food assistance go hand in hand, right? In order for somebody to be healthy, they need to be able to eat healthy food, but also be able to have access to healthcare in a regular way that helps support, the whole family's sort of quality of life. So I'm going to move on to the conversation with Dr. Ezike. Dr. Ezike, again, thank you for being here today. We also know that HR1 is going to be impacting our Medicaid and healthcare systems. It's going to impact the access that a lot of our neighbors have. And so as a result of staggered timeline to policy changes, from your perspective, what do these changes mean to patients, healthcare providers, and the broader healthcare system locally?
So much. Again, thank you for this convening, and a super thank you for the participants, for people who are interested in understanding what the situation is, trying to educate themselves so that they can, join in and try to figure out what the solutions are going forward. And again, thank you to my fellow panelists. Senator, I just want to say that you really, it really resonated when you just talked about the difficulty, like the administrative burden that's associated with just seeing mail and making sure that I am literally looking at a pile of mail that I have not looked at. And so understanding how real that is, that we're just creating a hurdle for people who actually do qualify and won't even will lose benefits just because of, how this is set up. So very helpful. I really want to keep figuring out ways to bring this home, because, there are policy changes every day. There are headlines, and for most of us and people on this call, we hear this and we're like, oh my gosh, what a shame. So whether our gas prices are going up, it's not stopping us from filling up our tank, right? When you say that people have lost their food benefits, it's like, oh my goodness, but we are not being stopped from eating. But there are people on the other end of the policies where it is affecting their everyday life, where, it's a crazy headline for us, but it doesn't change our life. Actually, there's one headline that's maybe changing people's life. I just talked about the cyclospora and the diarrheal illnesses. And so people are changing, a little bit, maybe are eating some different things, but in reality, it's the people who are most vulnerable that are actually being hit with this earthquake. And what's at stake is people living on the edge, being pushed over the edge. Once upon a time in the 1960s, there was a program put out. It was the War on Poverty. We're supposed to end poverty. now this is an assault on people who are poor. And I can't imagine how government's role is not to support people who are on the fringes, who are marginalized, but is instead to assault them. And so as we think about these policy changes, what that means for healthcare, that means that people will not have insurance. They will lose access to preventive care. We all know how preventive care is the best way to ensure, health and maintain health and have longer, not just lifespan, but health span. And now we're saying, nope, you won't have access to preventive care. You'll have difficulty. You won't be able to afford your medicines. You won't be able to partner with a doctor to ensure the health of you and your family. And so as people lose coverage, it doesn't mean that they don't need care. You lose your coverage, that doesn't mean the diabetes went away. That doesn't mean that you no longer will ever have a heart attack. It means that you will now put off preventive care. You will put off that primary care visit just to do the checkup and figure out how we're doing, figure out how to maybe titrate the medicines up or down. We will lose that, but health will not just stay static. Without that kind of care, without those interventions, without the prevention strategies, you will get sicker and sicker. And eventually there will be a level of sickness, an acuity of sickness that can't be denied any further. And so you will end up in an emergency room. So instead of a $50 primary care visit, you'll have a multi-$100,000 bill for maybe diabetes gone wild, maybe diabetic ketoacidosis, whatever, in the ICU. And so you'll have more people experiencing worse outcomes. And somebody still has to pay for that hospital visit. And so more people will essentially lose their health, have horrible outcomes. This disparity that we're trying to work against, that we're trying to promote equity, which, 4-letter word, not in this crew, those differences will just grow. And, at Sinai, where 70% of our patients are on Medicaid, that does threaten the healthcare for all the people in the community, because of course the patient is at the center. Sinai is right in the center, trying to support individuals. But as people are coming up, getting that ICU care, getting that care that we are not going to get, compensated for, that weakens our ability to treat anybody. We did $50 million of free or uncompensated care last year. That's not sustainable. Like, we are lucky to still be here. We get the award for being the most charitable institution in the Midwest, I think 4th in the country in terms of the amount of charity care and community benefit vis-a-vis our annual budget. But that's not sustainable. We can't do it again. And so you will see hospitals who are serving the most vulnerable actually just collapse, and then they'll be serving no one. And then people think, oh, what a shame for the poor people. But it's more than that. It is also that people who don't have a hospital in their neighborhood will now have to overcrowd the next hospital. And so now everybody's affected, because when you try to get emergency care or have to go to the ER or have to make an appointment, now you're talking about, oh, it's 9 months to get in. Oh, the ambulance had to bypass that hospital because there's so few hospitals now that they're all overloaded. And now for your emergency, whether it's a stroke or a heart attack, knowing that every minute is life, is precious life, because you need to get there and get the interventions. Now you have to travel 6 minutes, 8 minutes, 10 minutes further because hospitals are overrun. So we're really not thinking about the overall ripple effect, and we have to be able to intervene before. I mean, we've already seen 2 hospitals close just in the last 12 months. So there is a wake-up call already, and this is before the most deleterious parts of this bill have really unfolded. So we have to acknowledge where we're at. We have to figure out how we're going to provide the care. And I think there are, we'll probably get into that, but safety net hospitals who already do the majority of the care for the underprivileged need to be supported to be stabilizers for the community. And so when we weaken the safety nets or we take away resources from them by not having people be insured, it is a situation that is unfolding that will affect the entire city, the entire state, our country. Again, reality is that healthcare does not become less necessary just because you took away somebody's insurance. It just means that you are allowing people to get sicker, and you're actually driving up the cost of healthcare, because getting into the emergency room when you could have taken care of something much earlier, more upstream, months earlier, this is a poor economic decision, which will impact us all, impact a city and a state and a country. And I am excited that we have great people on this call who are invested, that want to be part of the solution.
Thank you. No, thank you again for helping us. I think this goes back to what everyone's been saying there. It's a system where these changes are going to impact systems, not just individuals. And I think that collectively, that's how we should be thinking about this. This is not an individual problem. This is not a person who made some bad decisions and now they can't have healthcare or food. This is a system-wide issue that will impact everyone, regardless of economic status. And so, shifting a little bit, I'm going to go into the Q&A portion. So if folks have questions, feel free to put them in the chat. But I wanna actually, this question is for all of you all. Obviously, you guys are already doing a lot of work on the ground collectively together. You've been doing the work even before the changes of HR 1. But, thinking about the work that you all are doing collectively, and what would success look like a year from now if the Chicago region communities, nonprofit, healthcare providers, policymakers respond effectively to these changes? And opening it up to whoever wants to start.
I'll start by saying what I think it's not. And I think there's a temptation in this moment, and I hear this a lot, people calling the food bank, food pantries, and saying, what can we do for you? And we're grateful for that. And I'm sure there are people on this call who have been incredibly generous in their support. And we are the most charitable we're the most charitable city in a country that is so charitable. But this is actually not a problem that can be solved by charity. And so I want us to resist the temptation to think about how do we solve this very acute problem that Dr. Ezike has just lifted up, that Sinai has a gap that is not sustainable. And as much as Sinai needs that support, we have to solve the underlying problem. Right? It is not sustainable, not only for Sinai, but for all of the other safety net hospitals. It is not sustainable for all of the other charitable food organizations. And so the solution is a solution of advocacy. We have to, and I'm going to go back to what Senator Guzmán said, like there's a morality piece here, and we have to talk about what is the role of government. Now I will agree with some of the folks who brought forward HR 1 that there is an opportunity to improve all of these programs. And I think we should look for those opportunities, but not at the risk of inflicting such incredible harm on neighbors and communities. One other thing I want to make sure that people are aware of, sometimes we talk about the changes to SNAP and the changes to Medicaid as being these two different things, and they are different programs. They have some similar tools that are being used to dismantle the programs. The timing's a little bit different. These are in many instances impacting the exact same individuals. So 90% of the people who benefit from the SNAP program in the state of Illinois also benefit from Medicaid. And the reason I lift that up is because the impact is not just the impact of losing the benefit to be able to purchase food. There is now going to be an additional layer of impact around losing access to medical support and medical care. And so imagine what that will mean for households. I am so worried about children, older adults, everybody who is vulnerable. And so success in part is going to be, and this is going to sound really, really dramatic, but success is going to be measured by not having people die. And I think it is unlikely that that will be the case. People are going to die. People are going to die because as human beings, we need food. People are going to die, whether it is because they can't access any medical care or because, as Dr. Ezike pointed out, the community hospital that is 10 minutes away closed and they can't get to another hospital. And it breaks my heart.
No, thank you, Kate. Senator Guzmán, Dr. Ezike, I want to provide you all the opportunity to also weigh in.
Yeah, I think if I could just add a little, I think part of what's really difficult about the next year is that the worst isn't here yet. We know that the federal government's interpretation of things is much more stringent than it could be. And so really thinking about what many of us, depending on what hat we're wearing, what we can do, the documentation of the atrocities on these programs is important. That's a lot of things. It's the data points, for example, that we're hearing. It's how we tell these stories. It's how we visibilize the hurt in our communities. It's also the advocacy of what we choose to do with it. The OMB comment periods, how it is that we work with our agencies to help ensure that we have compassionate implementation to whatever extent we're able to do that in our state. Those are all things that, I think we can hold. The other thing that, I think is super important is that why I think Fresh in this moment is an example of like how we need to navigate the next year is that we're going to have to do it together, friends. It's a moment that I think, as I wake up every single morning and I'm drowning in signal messages as my community continues tracking ISIS presence, we have to reckon with just the global hurt of what is happening federally, where an administration is seeking to fund mass deportation at the same time that they take away healthcare and food from millions of Americans and Illinoisans in this moment. And so we're dealing with trauma. We're dealing with structural hurt. We're dealing with people that are hungry. We're going to deal with people who don't have health insurance. And I think this is a moment where rising to the challenge is us being really real that much of what we're talking about is harm reduction. It's not going to overarchingly solve every single person's hunger need. It's not going to meet that every single person has access to what they have in their hands, but it doesn't make it any less important. And I think that's the beauty of coalition coming together is all of these vantage points kind of like all executing towards what can we do to make sure that as many of our folks that are going to be navigating these really big breaks in the programs get to do so and get to be seen and heard out of this process, but also get to drive what the solutions on the ground look like. So those are some of the things that when I think about, what a success navigation looks like, it's also how we do it. We're going to have to do it in coalition. We're going to have to do it with many of you on this call. We're going to have to do it with folks that right now are just trying to get to work, trying to get to school, trying to get to live, because I think the success also has to be an understanding that food is not a partisan issue, right? That every single district in the state needs food, needed food yesterday, needed food last year. And that the more people get to see that connection, we're actually creating conditions for us to be able to do even bolder work. And so when I really think about what that means in terms of the possibility at a time that the hurt is expanding in our communities, hopefully that means we've strengthened relationships, that we've strengthened the path for deeper policy, that we've protected more families, that we've been able to build more power to do more around protecting the safety net. But I think how we get to lean into that again is really going to depend on, how we exercise these coalitions and our commitment to one another, because the last piece that I'll leave you on is how this is being done is intentionally being done in a way that puts states to have to make the Sophie's choice Am I going to fund this? Am I not? Am I going to cut a population? Am I not? Am I going to turn on, a variable in terms of coverage or in terms of who gets stuff or not? It puts that squarely on states. And so in the absence of, just billions and billions of dollars for us to be able to do everything that we want to do, we have a choice in terms of how we're going to lean into policy decisions, implementation decisions, and budgetary decisions, which is why you'll hear me say that at the same time that our budget is a moral document, it's also incredibly important that we understand that budget can be a tool of solidarity to protect our people, that we can expand good revenue that allows us to continue feeding people, that we can expand good revenue that allows us to strengthen our safety nets, that allows us to strengthen healthcare, and that too is a policy choice of the state of Illinois.
No, thank you. Thank you so much. And I think, again, this goes back to food is a human right, right? This is not something that should be politicized. And unfortunately, it is. Dr. Ezike.
Yeah, no, Senator, thank you. If I can just add on to what you're saying. And I appreciate so much hearing, there's going to be pain. As Kate said, there's going to be death. And so we're not in, how do we just completely reverse this, but it's how do we mitigate it, harm reduction, as you said. And so that's a harsh but real thing to acknowledge. At the end of the day, we're in a great state where we know that our leaders, we have people like Senator Guzmán, we know that we're going to make the best decisions out of, pick the best of the worst decisions. But there is no way to fill the gap of what federal funding provides, right? There is no way that the state can cover all of the federal government's dollars that won't come through. And so we have to think above state government. And so, politics matters. Elections have consequences. Elections matter. It is probably not on accident that the effects, the Medicaid cuts with the redetermination will come in after the midterms. I think that is not a coincidence at all, right? And so because, people, if you see people like, oh, wow, the death rate has gone up because of this, because people didn't have food. Oh, now there's overutilization of the ED because people didn't have, if people were seeing that, that is a visual that you can't unsee. And hopefully that will motivate you to make some different decisions or to understand, well, how did this come to be? Oh, we might need to course correct. That is intentionally not going to be the case right at the midterms, but we still need to be working again on both sides of the aisle to make sure that we get people to understand what is coming, what we're already seeing, what is coming. I am hoping, I know it's not been good in the past, but I'm hoping that we can appeal to human decency to get ahead of just this horrible outcome that's looming, it's not even hard to imagine, but it's not going to be something that people can just stay in their corners. We have to have dialogue with people of different backgrounds, different ilks, different political backgrounds. We need to have real conversations. People always say, oh, avoid talking about politics, avoid talking about this. But if we don't talk about it, we're just going to see a very acute decline of systems that we have been able to enjoy, for generations. So now is the time to have some hard conversations, not just with people in this state, but across the landscape, across the country, because we really need at our federal level to have the changes that we need to support our states, to support this country. We can't do it just alone in the state of Illinois. We're going to do our harm reduction, but at the macro level, we have to have the right decisions being made at the federal level.
Thank you. No, and I want to thank you all again for those powerful statements and really helping to just put into context just how important it is, right, to continue to remain vocal and active on these really important issues that are going to impact everyone. So We are very close on time. I feel like we need a part 2 because there's a lot of questions in the chat, and so I'm gonna just do a couple of more like clarifying questions. So this question, either Kate or Senator Guzman, or actually Dr. Ezike, if you have the answer, is folks want to know a little bit more about the FRESH program. When can impacted individuals expect to get this one-time support, and how are they being notified of this relief?
So I'm happy to provide a quick answer. August 1 is when we anticipate that the benefit will flow out to people. It will get automatically loaded onto people's EBT card, sometimes called the link card, for individuals who are impacted, and they will start receiving notifications within hours or days. So the Illinois Department of Human Services is preparing to communicate out to all individuals in a variety of ways. So letters, texts, etc.
Great, and they don't have to enroll for this program. It will be
Correct.
automatically.
Correct.
And
It
that
is
I
automatic.
want to just again highlight that, because I think that originally we started off this conversation with people getting letters in the mail and not knowing where to go for enrollment. Just the fact that it's going to be done automatically is huge, and so kudos to you all for making sure that that was part of the FRESH bill.
And
or the way it's
recognition
being
of our
implemented.
leaders, our policy leaders, and also, for the senator, for other members of the General Assembly who leaned into that, but also to our leaders at state agencies. Yes, absolutely, it will be automatic.
Thank you. And then one last question for Dr. Ezike is, if you lost your health care, where can you go to receive services?
So that is the challenge, because typically Sinai and other safety nets are the ones that have been the welcoming health systems that say, we will take care of the Medicaid, the uninsured, the underinsured. But it is becoming increasingly more and more difficult to keep accommodating that, because at the end of the day, we still have bills. Like, it still costs money to take care of someone, the same amount of money to take care of someone who doesn't have insurance. And so being able to take care of people with nothing coming back threatens the entire existence of that organization. And so, yes, Sinai doesn't turn anybody away. And so probably more and more people are going to head our way. And so it's going to be really interesting how we maintain our survival under the weight of trying to carry and fight against the injustice of this bill.
Thank you. So we do have 2 minutes remaining. I want to thank you all again for being here today. Thank you for your leadership. Thank you for just being champions of people, of basic needs and just absolute humanity. So thank you all for being here. I'm going to talk a little bit about more how we can stay engaged and continue to have these powerful conversations. And want to again share with everybody on the call today that 211, and again, is a free resource. You can call 211 and we will give you updates on changes to all of the public benefits we talked to today. So we really want to make sure that people are calling this number so they get the most accurate information. So we're going to go to the slide. I believe the slide says stay engaged. Thank you very much. So want to make sure that people see the QR code here. You can help support United Way in the social safety net. You can give back through your time, financial gifts to support your neighbors. We also want to continue to champion shopping local, thinking about communities that are being the most impacted, the most vulnerable, communities such as Auburn, Gresham, Brighton Park, Little Village, and others. And then continue to attend our State of the Safety Net conversations. This is really a time that we set aside to be able to bring together some of the greatest thought leaders that we have and champions that are doing the work every single day. So again, thank you all for being here today. Senator Guzmán, Kate, Dr. Ezike, you guys are just powerhouses, and just so grateful to have you all do the work that you do.